There's a lot of reasons to talk about healthcare. We have pretty good healthcare, but I think it could be a lot better if everybody had open access to primary care. Healthcare is very expensive in this country. We spend $3.6 trillion on healthcare, which is about $11,172 per person. That was 2018 figures. It's probably gone up since then. It's expensive because it's very inefficient, and there's a lot of waste in the system. The incentives are wrong. The incentives on the provider side are to order and do more. And on the consumer side, it's to consume more. So that combination increases the cost of healthcare beyond what it should be. So my solution is what I call patient-directed healthcare that I believe could address cost and quality issues and health disparity issues, both health disparity as well as financial disparity. So the learning objectives, why are the best healthcare systems primary care based? Ours is not, it's specialty care and hospital based. What is direct primary care? This is what I'm talking about. It's a relatively new concept of healthcare that I believe should be the dominant form of healthcare. Health saving, my definition of patient-directed healthcare is health savings accounts plus DPC, as I'll go through. Why primary care should be independent, how patient-directed healthcare reduces costs but improves quality and increases patient and provider satisfaction, and what are the obstacles to healthcare, and how could the success of patient-directed healthcare be measured. So I want to go back to a paper that I wrote when I was a second-year resident because it has a lot of the ideas that I still believe in and that form the basis of my patient-directed healthcare, nimble healthcare. I wrote it in 1972, and the issues I was one of 126 second-year residents, the first residents in family practice at the time. Why was family practice certified in 1961? There are a number of reasons. There are 3 reports that gave a litany of reasons why we needed primary care, but one of the most important was that in the 1930s, 70% of physicians were primary care physicians. In 1969, it had dropped to 21%. In the paper, I pointed out the team approach to primary care, which was a new approach at that time. We basically, physicians practiced independently on their own. I pointed out that we needed to understand the psychological components of disease because the psychological components were very important, and that included family dynamics. So family practice was a new concept that emphasized family dynamics. I described the family practice model clinic. Also, family practice certification was the first to require recertification. Up until that time, you got certified and you're certified for life. It was every 7 years for family practice. Other specialties followed suit. Now it's every 10 years. But the most important thing was I felt that the goal was sufficient number of competent primary care physicians to coordinate the teams to meet the healthcare needs of the nation. And I still believe that, and I believe that we haven't done that. When I wrote up this concept of healthcare, I was looking for a name, and I liked the name nimble. Something that's quick-witted, adaptable, flexible, can adapt to changing healthcare conditions quickly. And then I made an acronym out of it. N for nourish character, I for ingest wisely, M for maintain health, B for be responsible, L for live intentionally, and E for energize America. Probably the most important thing in healthcare reform, in my opinion, is to change the character of the delivery system. And the four important points are: get it to be a primary care-based system. I believe direct primary care is the best way to do that. Have health savings accounts for everybody, and that primary care should be independent. The reason for a primary care-based system and why it's superior is that the things that cause morbidity and mortality right now are chronic conditions that need to be treated and addressed incrementally to decrease the risk of catastrophes. That includes like heart attacks, strokes, cancer, early recognition of cancer, diabetes, high blood pressure, etc. So primary care is much better at addressing that, and we don't have a good primary care-based system. I believe that we should change to direct primary care. And direct primary care is a contract between patients and their primary care providers, without any insurance, without any intermediaries. It was actually preceded the concept of insurance in our country. The Northwest Loggers Association around 1900 prepaid for their health care because they had a lot of health care issues. Insurance didn't come in until 1929 and 1939. The 5 primary components of direct primary care are service and open access 24 hours a day to primary care advice, patient choice, that it's a partnership between the doctor and the patient to decide what care options should be taken, elimination of fee-for-service. Fee-for-service kicks up costs because there's cost for every transaction. Prepaying it, you have a set cost. Advocacy, we need to advocate for patients for the best services, the best location, best specialists, best hospitalists, best lab, x-ray, procedures, radiology. There's a tremendous difference in pricing. And if you had an independent primary care, you could dramatically decrease the cost of all those services. Final thing is the actual stewardship of dollars, of patient dollars, looking for and being aware of what costs are. Right now, everything's consolidated into monopolies and duopolies, and you don't really have choice because it's just baked in. And that's a tremendous accelerator of healthcare costs. So open access to primary care, eliminate costly insurance intermediaries, and incorporate telehealth. When you prepay for it, telehealth has the potential to dramatically decrease costs. A lot of what you go into take time off from where you work, go into see a doctor's office, wait in the doctor's office, expose yourself to the germs there, and be seen, could be eliminated by telehealth. And it's too expensive. If you pay for it a la carte with each telehealth unit, that's very expensive. It's better just to have that included in your primary care fee. And the second, an important part of patient-directed healthcare are health savings accounts. You need to have catastrophic coverage for those events that are catastrophic. And health savings accounts provide that. But it also changes the incentives. If it's your money in your health savings account, you're going to be more cost conscious. You're going to say, do I really need that? What benefit is of it to me? The sort of questions we should all be asking rather than I've got insurance and I want to make sure I utilize it as much as I can. So by changing the incentives, it will dramatically make us more cost aware and decrease the total overall cost of healthcare. And then primary care should be independent. And the reason it should be independent is that if you want a consumer-based healthcare system, you need to have an independent, I go back to the 5 points of direct primary care that's on the website of Principles at DPC, if you want to see them in greater detail. You want to have somebody that's advocating for you both in your choices of other services, lab, x-ray, procedures, specialists, hospitals, rather than go into these corporate entities that consolidate everything and really give you little choice in where you get your services. And there's dramatic differences in the cost of all those things.